Hi everyone, it's Dr. Kim. So we've been posting a lot recently on PRP hair restoration, and this particular video has gotten a lot of views, 1.6K views, which is pretty good. And I love it when people post questions because it gives me a chance to answer you and share some more information. So the question that was posted was, please post references to the studies that actually support this treatment. Hard to read tone, but seems like he's doubting maybe whether this actually works. And I understand that, I get it. There's a lot of snake oil out there for hair regrowth. And we've been posting pictures of our results, which are so amazing. I understand it's hard to believe they could actually be true. So let's look at the literature that supports PRP and see what we can find. Okay, so I went to PubMed.gov. This is the database for medical literature that has been published. And I typed in PRP. I just did a very basic search. We could go into the advanced search option and type in different combinations, like actually type out platelet-rich plasma, different combinations. But I just wanted to do a simple search, PRP. And what did I find? 18,396 results of papers, scientific papers that have been published on PRP in its various forms and for varying uses. So it's definitely a technique. Almost 18,500 studies published on PRP. Definitely not an experimental new technique. So let's look at PRP for hair and see what. Okay, so I went back and I typed in PRP hair. Again, I could have typed in a bunch of different combinations, PRP hair restoration, PRP alopecia, PRP androgenic hair loss, all sorts of advanced searches I could have done, but I just want to keep it simple. So PRP hair gave us 194 studies, 194 scientific publications looking at the application of PRP or platelet-rich plasma in hair growth. Nicely summed up, 2019 article here, the Journal of Skin Therapy, basically summing up the current literature, but there's been a whole bunch published since 2019 as well. The results are that PRP works to regrow hair with a couple of caveats that we need to talk about. It works under certain circumstances in certain select patient populations. Okay, so we know that PRP works for androgenic alopecia, which is male and female pattern hair loss in early stages, if caught early when we still have follicles that we can save. It also works in telogen effluvium, which is hair loss from stress, by speeding up the natural process that would happen. It's likely not going to work very well in some of the scarring alopecias, but the science is still out on that. So it is important that you see a physician who is specifically trained in hair loss in order to diagnose the type of hair loss that you have to determine the proper treatment and whether or not PRP is actually going to work for your type of hair loss. Now, the other controversy in PRP is how exactly do we do the PRP? There's a whole bunch of different techniques out there. There's different tubes, there's different spinning controversy. Do we spin it down once? Do we spin it down twice? What kind of tubes do we use in order to get the best concentration of platelets? And do we activate it? Do we not activate it? Activating PRP is adding some calcium chloride into it, which turns on those platelets and gets them releasing their growth factors. So the science is out on PRP in terms of the best possible protocol and technique, and that's where the controversy is. Which way of doing PRP is going to give us the best results? What is not controversial is that PRP in appropriately diagnosed hair loss, appropriately diagnosed types of hair loss, is going to work. Proper selection of patients, proper diagnosis, and then technique. So PRP itself, I know it seems kind of magical, and you look at some of our results and think there's no way that hair grew back. but it did, because we are picking proper patient selection. We are using the most advanced techniques in terms of prepping our PRP, and we are getting fantastic results. So again, I love it when people respond and they post videos because it gives me a chance to share more information. 194 studies just in the last couple years on PRP in hair alone, with almost 18,500 on PRP in general. Fantastic treatment. We're getting amazing results. If you're interested in finding out more, book your consult, come on in. And as always, if you have more questions, please post them. I'd love to be able to answer you.